House Freedom Caucus members holding a closed meeting tonight, we are told. Healthcare on the agenda as they are expecting some alterations to the bill to be released any moment now. This, of course, as conservative lawmakers have been pushing for a clean repeal, and that faces some big hurdles. Health and Human Services Secretary Tom Price shooting down a clean repeal of Obamacare this weekend, in fact, arguing that doing so would put, quote, vulnerable people at risk. Earlier, I asked Representative Duffy about some of the hurdles that this bill continues to face. Take a listen.
Just looking at the House perspective, because this is the first vote that's going to come up on Thursday as the target, we have the Republican Study Committee. That's a bunch of Republicans. I'm a member of that group that are conservatives. But there's another conservative group called the Freedom Caucus. Now, the Freedom Caucus guys have come out and said, we're not quite sure about this reform package on health care. This is where Donald Trump comes in. He steps in and uses his negotiating tactics. He's able to maybe tweak the bill a little bit to make them a little more happy. But I think there's a great opportunity for us to pass this bill on Thursday.
Here to discuss Brenberg and Amy Holmes. Okay, there are two parts of this. There's the political part, and then there's the health care part of it, how it impacts the economy, how it impacts health care. On the economic side, getting rid of almost $900 billion in taxes, lowering the debt by over $300 billion. Those are pretty good things.
They are good. And look, we had the CBO report last week. Everyone was talking about that. The truth about the CBO report is it can't take into account the macroeconomic effects. It can't take into account how innovation might enter the market as a result of consumers having more choice. So it's not going to bake those gains into the reports. When we look at those numbers and we get concerned about how many are going to drop off of insurance, we have to remember the CBO report is not fact. It's an assessment, and it has constraints. I think there's some upside.
So you think you add in some pro free market principles, pro business principles like selling across state lines and things like that, and it blows that whole assessment out the water?
Not completely out of the water, but the assessment is limited. Those things would help. The problem right now is some of those big pro market reforms are in this phase 2 and 3, which really people don't believe is going to happen. That's where the real resistance is on the Senate side. They don't think it's going to happen.
But before we get to that, Amy, a week ago, at least 25 members of the Freedom Caucus were either no or leaning no. That would be enough to sink this thing on Thursday. What do you think?
That absolutely would be, and so is the opinion of the American people at Rasmussen Reports. We've polled likely voters how they feel about Obamacare repeal, and only 25% of likely voters want to see a total clean repeal.
Well, we're not getting a total clean repeal, but what about this? Have you done anything with this new bill, this new version, which is going to bring down debt, remove taxes, let small businesses grow again, and let the wheels sort of lubricate the wheels of commerce that has grinded to a halt?
What we do know from history of polling data is that the public is for some of these reforms, but in a piece-by-piece way. And I would say you can't separate the politics from the policy. As Senator Tom Cotton pointed out, if this is front-loaded with pain, you're never going to get that gain because voters are going to vote those guys out of office.
That's what Ted Cruz is saying, though. Ted Cruz is saying that they're going to be tarred and feathered if you go for it in its current form. Obviously, I think it won't go in its current form, but the question is, will they give enough? Because the scuttlebutt coming into the studio, it sounded like it's still not going to be enough. What do you think ultimately has to have? Do you think there's a happy medium somewhere there?
There maybe is a happy medium. I think they might actually have to try to cram more into this reconciliation they've been talking about. Again, you go to some of the stage 2 and 3 pro-market reforms like selling insurance across state lines. Nobody in the Senate believes that's actually going to happen, but Senator Ted Cruz this weekend, for example, said, why don't we try to put that into the bill right now? Let's put this through the reconciliation process. I think some creative...
Part of that is because they're looking at the politics of it, and you've got to put stuff in there that is going to benefit the voters right now. You can't have the pain of shrinking the Medicaid expansion, having 24 million people lose that Medicaid expansion, and expect to stay in office.
And that's why I think they're going to get more.
They're going to block grant the Medicaid, I think, pretty sure. And they're also going to make sure people work. Like, hey, you know what? You can get up and go to work. They're going to put some things in there that really gnaw at the average taxpayer who's loath to think that someone is sitting at home collecting a check while they get up every morning and punch that clock.
And that's why the tax reform has to follow on this so quickly, because Americans have to believe I'm going to have a job. At the end of the day, job is the best predictor of having health insurance. They've got to get back on that track.